A new study finds the use of weight loss drugs like Ozempic, Wegovy, and Zepbound in people with type 1 diabetes has risen sharply. It comes even though there's little information on the drug's safety and effectiveness for the condition. Joining us to talk our health headlines today, he is Dr. Bill Hartman, the clinical trialist at UW Health. Doctor, great to see you. And maybe you were like me reading this. Well, I know you weren't because you're a doctor, but I was reading this saying, wait a second, aren't these drugs designed to treat diabetes? Wait, that's type 2 diabetes. What did this study tell us?
Right. So, there are two types of diabetes, type 1 and type 2. Type 1 has to do with a lack of production of insulin, where type 2 diabetes has to do with a resistance to insulin. These drugs, the GLP-1 agonists, were created to treat type 2 diabetes. But over the last 10 years, they've seen that doctors have increasingly used the GLP-1s to treat type 1 diabetics who have obesity. They have seen some good results. They have seen decreases in the amount of insulin that type 1 diabetics have to use. It's likely due to the reduction in weight. I think it's very important, though, to point out that these aren't for every type 1. There's always that risk of getting the blood sugar level too low if you're using these and you're a type 1 diabetic. And so you should really be under the direction of your doctor and make sure you talk about this with your doctor before starting these GLP-1s.
You know what I found interesting? I mean, the doctors always say, lose weight. If you've got diabetes, it can make all the difference. But I didn't realize insulin actually can prevent you from losing weight, which is why these drugs are so effective.
It's one of the reasons that these drugs are so effective. These drugs also have a profound effect in terms of decreasing the gastric emptying time, and so you feel fuller longer. It probably also has a reward benefit within your brain so that you think that you're full longer. And so there's many different effects from these GLP-1s that have great benefit in terms of losing weight.
But you make a good point. At what price are you paying for this, or what's the catch here? Talk to your doctor about this, because, yeah, there may be some side effects. Hey, speaking of diabetes, a new study says eating certain food additives together may increase our diabetes risk. What should we steer clear of?
This was a really interesting study out of France. And what they did was they looked at 5 common groups of food additives that people typically eat together. A lot of these additives have been studied in isolation, but that's not how we eat. We eat with things either in one meal or throughout the day that have multiple additives in them. And what they found was that 2 of these particular groups were associated with developing diabetes, type 2 diabetes. Particularly, these were combinations that had a lot of emulsifiers or thickeners in them, or that had a lot of artificial sweeteners and dyes in them. And so I think that the real take-home message from these studies is that you should probably cut out as many of the calories from ultra-processed foods that these additives are associated with to decrease your chance of developing type 2 diabetes.
So Mom was right this whole time. Eat your fruits and veggies, huh?
100%. That's the best way to go.
I can't always say I've listened to that advice, but I do agree with it. Dr. Bill Hartman, thanks for joining us this afternoon. Appreciate your time.